everything will be published, if it's good or bad. And because Baker shows that this system is very efficient also for the companies, because they can save a lot of money for useless trials, or for trials that another company is doing at the same time. So many things are going in parallel, but the other nobody knows about that. So this could save a lot of money at the end. You can load down this very good detailed concept from the internet. The main problem is implementing this against the resistance of the industry, and to convince the finance ministers to invest in that, because you need some primary investment and then...
Some information about Spain, no? Aquí a Espanya ja des de l'any passat i aquest any el que és el FIS té un programa especial d'investigació clínica independent. It's a clinical investigation, independent clinical investigation, no? Program that it's funded by probably from 10 to 12 million euros cada año, o sea que prácticamente entre 10 y 12 euros al menos este año, ¿no? Y entonces, bueno, yo creo que se han abierto algunas puertas, pero también es verdad que allí puede presentarse todo y que va desde lo más básico, clínico, hasta lo más aplicado, Y entonces, y el otro problema que yo veo es que las prioridades son muy amplias, ¿no? Puede entrar cualquier cosa, ¿no? Entonces, el problema es que parece mucho dinero, it's a lot of money to do one trial, but it's not a lot of money to do 10 trials comparing the best anti-osteoporosis drug, because you need 1,000 of patients, and to pay that it's a lot. So, and you go to hospitals and clinicians that assume that que deben I'm not able to explain that in English. Okay. So that is it's that the médicos que están acostumbrados a trabajar con industria farmacéutica y que están acostumbrados a recibir un cierto dinero para que funcionen sus departamentos. Entonces esto es muy caro. Y entonces, claro, parece mucho dinero, 12 millones o 10 millones, pero cuando te pones a hacer un estudio de un problema, pues la hipertensión o la osteoporosis o el acné, que necesites miles de pacientes, el dinero, y que además el ensayo clínico tendrá que hacerse con condiciones de good clinical practice, etcétera, it's not so much. O sea, yo creo que se necesitan iniciativas no de un solo país, se necesitan iniciativas superiores y de estudios multicéntricos de más gente, ¿no? Porque, bueno, a lo mejor tardamos 5 o 10 años en tener el resultado, tampoco nos sirve para nada, ¿no? It's just a clarification about this interesting program in Spain. ¿Alguna pregunta més? Joan, sí.
La pregunta és per Christian Wagner, però bueno, qualsevol de les persones de la taula pot tenir, suposo, una opinió. Sobre el tema de la publicitat, estic totalment d'acord que aquesta publicitat més aviat emotiva, no? Que es fa sobretot als Estats Units, directament al consumidor, no aporta cap informació. Però jo també penso que un problema que s'hauria d'enfrontar és que, en general, el ciutadà, el pacient, demanda informació i crec que hi ha un dèficit. És a dir, que en general el sector públic i els instituts sense fi de lucre no li estan donant prou informació i que per això llavors estan disposats a buscar amb altres fonts, internet, etc. Llavors, jo no sé, la meva percepció també és que, per exemple, les agències reguladores no són especialment transparents en per què s'aprova o no s'aprova un nou medicament o per què es fica dintre del catàleg del sistema públic, no? O sigui, tot això hi ha una certa foscor i manca de transparència que penso que dona més força davant de l'opinió pública a les demandes que fan ara les empreses farmacèutiques que diuen, bueno, nosaltres d'acord, publicitat no, però volem donar informació objectiva. El que em pregunto si és que les organitzacions que esteu treballant en aquest tema us plantegeu també exigir al sector públic que sigui molt més transparent i doni resposta a les demandes d'informació que crec que està fent la societat i els pacients.
Yes, I absolutely agree with your analysis that it's quite difficult for consumers and for patients to find the right information, because we have so many information. If you go to the internet, you have an overwhelming amount of information, good information, bad information. So what people need is knowledge about what sources of information are good. So they need someone to help them to make their selection. And one very important institutions should be the regulatory bodies on the national level and also on the European level. If you go to the website from the EMEA, from the European Medical Agency, it's for an average consumer quite difficult to find what you're looking for and then to understand what they are writing. So we ask governments and the European Commission to change, to work on this issue also.
I think it varies a bit from country to country. I think there are countries where there's really rather good drug information for patients. I think in some of the Scandinavian countries. In Britain we have something called the British National Formulary, which is produced by the Royal Pharmaceutical Society and the British Medical Association. But that's information for doctors, but the attempt is to make that independent. And actually that's been going for 30, 40 years. The other thing we have in Britain, which I know is of interest in other countries, that it used to be that once a drug was licensed, it had been through the EMAA or our British equivalent, then it was on the market and anybody could prescribe it within the National Health Service. But now we have something called the National Institute for Health and Clinical Excellence, which has been going, I suppose, must be nearly 10 years now. And they look at every new drug, and they look not only is there evidence that it's efficacious, that it works, but is there evidence that it's better than what is already available? And also they look at cost effectiveness. So if it costs more than £30,000 for a disability adjusted life year, which is a technical term, a way of, so it's not just about do people live longer, but is the quality of their life improved, then on the whole they won't approve it. And we've had a lot of drugs that are licensed for the market but are not available on the National Health Service because NICE judges that they're not worthwhile. And their process is pretty transparent, and it involves a lot of citizen and consumer input as well, because in the end this is in some ways a value judgment. It can't be done just on scientific evidence. And really almost the only bit of the process that isn't very transparent is some of the evidence submitted by pharmaceutical companies, which seems a bit of a shame, but that's been allowed. So I think, and actually, often it's patients who get very upset with the results. So some of the drugs for Alzheimer's, NICE has said these are not worthwhile. Many of the new drugs for cancer, they've said there just isn't value. People live a few more weeks, but they're enormously expensive. There isn't value for money. So often it's patients who are fighting against the decisions of these companies, of NICE, although the pharmaceutical companies don't like it either. And one of the other complications is that a lot of patient bodies that appeal against these decisions, when you look closely, you discover they're funded by the pharmaceutical industry.